NPTE StudyCast.
Welcome to NPTE StudyCast. I'm your host, Jimmy McKay, along with
Bridget Ripa.
Bridget, welcome to the show and helping students pass the big, scary NPTE.
Thanks for having me.
But it's not that big and it's not that scary.
It's not. If you walk out of it and you feel like you failed, you probably did fine.
Bridget, you're at Duke University and you went through Duke's DPT program and you're an NCS.
I am.
So we bring you in for some neuro stuff.
My favorite. Let's talk about ischemic stroke.
So, what is it?
How do you describe it to someone real briefly?
Ischemic stroke is when vessels in the brain get obstructed and result in poor blood flow to any one part of the brain.
Typically, what's involved? Well, we know blood vessels and the brain.
It could depend on what type of stroke it is, whether it's a thrombosis or an embolus.
Those words sound familiar, but I don't work in neuro, so what are those really, really briefly?
So a thrombosis is the result of plaques that form in the brain over time and then obstruct blood flow, versus an embolus is the result of a clot that travels to the brain from another part of the body.
Differential diagnosis.
Now, is there anything else it could be? We always like to know that on the NPTE they ask differential diagnosis questions. Kind of cross you up. Is there anything else this could sound like?
They're usually other brain disorders, right? So it could be something like a TIA, which usually resolves in 24 hours, so you'd know pretty quickly if it was a TIA or not. It could be something like an ICH or just a big brain bleed. Encephalopathy, seizure, brain tumor. You can kind of start to worry about some of the metabolic disorders. That's probably the big differentials.
Special tests.
Now, how would you rule an ischemic stroke in? What would be the big red flag that you say if you're sitting there taking the NPTE, you're like, oh yeah, this is definitely what I'm looking at?
Yeah, so the CT is always the primary imaging for evaluation of a stroke. Whether it always shows what's going on is debatable, but it's widely available and it can be performed quickly. And it rules out a hemorrhagic stroke, which is the big key, I think.
Differentiating between those two.
Exactly.
Treatment examples.
We're going to see patients after the ischemic stroke. What does a PT do about it? What are we doing in treatment for people who've had ischemic stroke? What's the patient going to present like?
So I always start with the ICF model and consider, the body function and structure and the impairments, activity limitations, and participation restrictions. And so I always kind of use that to guide my treatment. I don't think we should always treat every stroke patient the same, obviously, but use that as a model to address motor learning, task-specific training, neuromuscular reeducation. Weight bearing and tone management is huge in the stroke population, whether they're hypertonic or hypotonic. And then your basic aerobic training. You just want to really consider high-intensity progressive exercises with these patients. And then you can consider things like functional electrical stimulation, constraint therapy if it's appropriate, things like that.
Here's your example question.
The all-important sample NPTE question. Students want to know, how will this be tested?
Going back to some of the imaging things, you could see a question that may be phrased like, a patient enters an emergency department with suspicion of having a CVA. The physician may order a blank to determine if TPA is appropriate. And the answer there would be a CT scan. We wouldn't want to administer TPA to somebody who is potentially having a hemorrhagic stroke, so you'd want to rule out hemorrhagic stroke versus a ischemic stroke. The boards are never going to just ask you a question that you can memorize the answer to. They want you to apply your knowledge. So.
Right. Perfect. That's ischemic stroke in 10 minutes or less.
NPTE StudyCast. Brewed by the PT Pintcast.